As we told you, flames breaking out in Santee just hours ago, burning close to some homes, prompting an evacuation notice. Firefighters on the ground are making good progress, though. That fire broke out near Chaparral Drive this afternoon and is holding at about 30 acres. There is an evacuation notice for those living along Princess, Joanne, and Dakota Ranch roads. We have team coverage, beginning with ABC 10 News reporter Laura Acevedo, who is live on the ground in Santee. Laura.
And Lindsay, this fire came dangerously close to homes. I'm going to step out of the way just to show you this is still a very active scene. A lot of sheriff's department firefighters. You can see the homes, and if you just look up the hill, you can see where that fire burned. There are actually crews that are still out here at the moment putting out those hot spots from earlier this afternoon. I do want to show you some video from Sky 10. The fire was first reported around 1:30 this afternoon. The flames filling an open field behind the homes here on Chaparral Drive and Cuyamaca Streets. Now, some homes were evacuated while crews fought the flames from the ground with the help from water drops. But again, that fire was stopped before it was able to get close to any of these homes. Now, again, this scene is still very active, even though much of the fire is under control. There is a large firefighter presence, also some law enforcement blocking off Chaparral Drive here. Most of the people are in their homes since the fire, you can see, is very much under control now. But of course, crews staying out here to make sure that nothing flares up as the winds, light winds, continue. So far, the cause of the fire is still under investigation. Reporting live in Santee, Laura Acevedo, ABC 10 News.
Thank you, Laura. Now we want to bring in meteorologist Angelica Campos. And Angelica, this fire comes as we're expecting even more Santa Ana winds, correct?
That's right, Lindsay. We're in the midst of weak Santa Ana winds, which really displays how it doesn't take much to create hazardous conditions, and fire weather remains elevated through tonight. As we look now at the relative humidity and the winds, you can see how those winds are gusting up to 15 miles per hour in Julian and Alpine and near the area where that fire is. We have seen some gusty conditions, but it looks like the winds are getting better. And there's a relative humidity averaging around 12-14% within that region, so it is very dry. There is some good news. We could be looking at a chance for a slight spotty shower and higher humidity, but the problem is that it's only going to be a matter of a day, and then we'll be back in Santa Ana conditions, so elevated fire danger. Certainly in the outlook for the next 7 days. I'll have a closer look at what to expect coming up.
All right, thanks, Angelica. And of course, you can keep track of the breaking alerts on this fire with our ABC 10 News mobile app. Now to the coronavirus pandemic. The number of available hospital beds in our region is inching closer to zero. Our current ICU capacity is now at a sobering 0.5%. This comes amid a record-breaking number of cases and deaths reported in California today. More than 53,000 new cases and more than 290 new deaths. ABC 10 News reporter Jennifer De La Cruz explains how hospitals are stretched to the limit.
In a press conference Wednesday, county supervisors stressing our battle with COVID-19 is far from over.
Thanksgiving holiday season has hit us really hard. A significant increase, record numbers of cases, massive increases in hospitalizations, and significant jumps in reported deaths attributed to COVID.
ICU capacity for Southern California has plummeted to just 0.5%. Supervisor Nathan Fletcher says vital surgeries for cancer patients and organ transplants have been put on hold to make more room for COVID patients.
The staffing challenges are real, and it could mean that we may not be able to actually staff the available ICU beds that we have today.
On Tuesday, Governor Newsom made a sobering announcement in response to the state's highest COVID-19 surge to date. About 5,000 body bags and dozens of refrigerated trucks have been ordered and are on standby. The county says they have not heard if any of those are being sent here. They added they've already had extra bags and trucks on standby since the start of the pandemic, and those still haven't been used. Although we've reached a turning point, we are still very close to another holiday that will tempt many to gather together.
In less than 10 days, we will head into the Christmas season. We have to take action different at Christmas than we did at Thanksgiving.
On Monday, the county received its first shipment of the Pfizer vaccine. A total of 28,000 doses are being administered to frontline workers, but the county says that's only enough to cover 72% of healthcare workers at the top of the list to get it. All 28,000 recipients will get their second dose when more Pfizer vaccines arrive. Jennifer Dela Cruz, ABC 10 News.
And here are the latest coronavirus numbers in San Diego County. Today, more than 2,800 new cases were reported, bringing our total to more than 114,000. 23 more deaths were also reported. In total, more than 1,200 San Diegans have died from this virus.
There is so much attention on vaccines bringing this pandemic to an end. But let's face it, that's going to take some time. Meanwhile, at-home testing could play a really valuable role as we move forward. Now, the FDA has just approved its first COVID-19 test that you can do at home without a prescription. A pretty cool part of it is it provides results right away. You don't have to mail anything in. This is made by an Australian company. The cost as well, it's an improvement. Only $30. You compare that to some other tests that could be more than $100. Now, a limited supply will make its way to U.S. stores soon, with production expected to ramp up next year.
It doesn't really get us to a place where at-home testing would really change the course of the pandemic.
Infectious disease experts have long said that we need a national testing strategy, and at-home testing is the same. Dr. Shira Doron says in order to turn the tide, you would want people to be able to test at home or at least several times a week. So even though we talk about how this test was a little bit cheaper, it would need to be even cheaper than what it is. There also needs to be an education component, like following up with a PCR test if the at-home test result is positive. Now, she's less worried about false negatives than false positives because of things that she has seen play out so far.
In the hospital setting with around false positives, is people being put in a room together. In college settings, people being put in a room together.
Now, she is more optimistic about the vaccine. She was one of the first at Tufts Medical Center to get the Pfizer COVID vaccine just yesterday.
I'll just take the fact that I'm not going to use up an ICU bed. That in and of itself, to me, is huge.
She does say she has a little bit of arm pain and she can feel it working to the point the second dose may keep her home a day or so.
Lawmakers on Capitol Hill seem to be getting closer to passing a second coronavirus relief package. The nearly $900 billion package could include another round of stimulus checks. The deal House and Senate leaders are considering would add the COVID relief package to a giant must-pass government spending bill due by midnight Friday. It's unlikely it would include more aid for states and local governments.
We start the news feed with Secretary of State Mike Pompeo in quarantine. The State Department says he came into contact with someone who tested positive for COVID-19. He's tested negative, but medical professionals are keeping an eye on him. In the meantime, the State Department will be getting a limited number of COVID-19 vaccines this week. It says it plans to give them to frontline medical workers and American personnel in Afghanistan, Iraq, and Somalia. Well, there's a surplus of the monoclonal antibody treatments that can be used for people with COVID-19. Health and Human Services Secretary says patients are waiting until they're at the hospital to be treated, and that it could be too late by then. He is urging doctors to prescribe these treatments earlier for anyone over 65 or at a risk of serious complications.